What is stem cell therapy? Stem cell therapy is one of the most promising and fascinating fields in modern medicine. It focuses on using stem cells, special cells with the unique ability to develop into many different cell types, to repair, replace, or regenerate damaged tissues in the human body. Unlike most cells, stem cells are not limited to a single function. They can divide repeatedly and transform into specialized cells such as muscle cells, nerve cells, or blood cells. To understand stem cell therapy, we first need to understand what stem cells are. There are two main types. Embryonic stem cells come from early-stage embryos and have the ability to become almost any cell in the body. Adult stem cells, on the other hand, are found in tissues like bone marrow, fat, or blood. These cells are more limited, but still extremely valuable for medical treatments. In recent years, scientists have also developed induced pluripotent stem cells, or iPSCs, which are adult cells reprogrammed to behave like embryonic stem cells. So how does stem cell therapy work? The idea is simple but powerful. When tissue is damaged due to injury, disease, or aging, stem cells can be introduced into the affected area. These cells may replace damaged cells, reduce inflammation, or stimulate the body's own repair mechanisms. In some cases, they directly transform into healthy tissue. In others, they release signals that help existing cells heal more effectively. Stem cell therapy is already being used in certain treatments. Bone marrow transplants, for example, have been used for decades to treat blood cancers like leukemia. Researchers are now exploring stem cell treatments for conditions such as spinal cord injuries, Parkinson's disease, heart disease, diabetes, and even vision loss. However, many of these applications are still in experimental or clinical trial stages. Despite its enormous potential, stem cell therapy also raises ethical, technical, and safety concerns. Issues such as uncontrolled cell growth, immune rejection, and ethical debates around embryonic stem cells continue to be discussed. As research advances, scientists aim to make these therapies safer, more effective, and widely accessible. Stem cell therapy represents a shift from treating symptoms to repairing the body at a cellular level. While it is not a cure-all yet, it offers a glimpse into a future where the body can heal itself in ways once thought impossible.